Hello, I'm Denny Michaels, co-founder and CEO of MILA International. We're here today to talk about injection ports, which are needle-free. They're also called stasis valves. And at your practice, you may also call them bungs, PRNs, or just plain adapters. But if you do so much as put in little peripheral IV catheters or bigger jugular catheters, be they single lumen or multi-lumen, you need to know the details about this injection port. The one I have in my hand is the stasis valve in its simplest form. And what this does, as in its simplest form, it can screw directly onto an IV catheter, like that. So you can take a syringe, push it in through a split septum, and that allows you to draw blood or administer drugs. What you're more accustomed to seeing, I believe, is putting an extension onto your peripheral IV catheter. And a lot of folks will use the T-set. And this is the old-time injection port. You can still put a needle in that, but gradually you'll see this T-port, this piece, be replaced by needle-free as well. This is what I'm talking about as far as the needle-free port. And this is a tethered cap. It's not required that you use this. This needle-free valve that I'm going to tell you about is completely sealed. You don't have to worry about dirt getting on it. But because these were invented for humans, and as we know, animals sometimes get a little diarrhea, whatever, onto their instruments, we put that on there just to be nice and clean. So you can pop it on when you're not using it, but you can also cut it off if it's in your way. Don't worry. When you go to use this port, you want to use proper hand cleaning. Put your hand sanitizer on or wash your hands. Let that dry. I'm going to go through this a little bit faster than I would in a clinical setting, just in the interest of not boring you. And I'm going to take an alcohol swab. And then the protocol is to swab this flat surface. There's a little split septum there. You swab this for 15 seconds aggressively. And then you will take your sterile syringe. You can use either the slip lure or the lure lock. First I'll do the lure lock. You screw it in, line it up, push it, screw it in, and like I said, push, pull, or push. And how does that work? You're not trying to get this surface sterile. It's not really coming in contact with the inner part of the syringe. Just to explain it very briefly, there's a blunt cannula inside there that goes up inside here, and that's what creates that dedicated fluid path, so that the outside of this is never really in contact at all with your medication or your fluids. The other syringe, the slip lure, or even an IV set with the slip on the end, can work just fine. But I'm going to show you what not to do. Don't do this, because that can slip out of there very easy. Put it in, give it just less than a quarter turn even, and then test it. And it feels quite firm, and then you can go ahead and take care of your procedure. Now I'd like to show you a couple of more ways to use this type of a valve, a stasis valve. One is if you're going to spike a bag, if you're in the habit of spiking a saline bag and filling syringes repeatedly, you know that can be quite laborious and time consuming to fill syringes through a needle. So this is called pin 3. It just costs a couple dollars, and you spike the bag with this, and then you can fill the syringes just so quick. Of course, you do your protocols as well, swab it and everything, but you can pull really fast from the bag. And this can save lots and lots of time. And therefore, and time is money, as we know. So this has just been a real gift. And then here we are with the valve in another configuration. It looks like a cricket to me for some reason. Okay, so with this, the idea is that you can draw from a vial, a multi-use vial, without putting contaminated room air back into the vial in order to overcome the vacuum. So I'll show you how that works. So once again, you make sure you, after you've opened the vial, you make sure you do the 15 seconds of swabbing. Okay, and then this would be sterile. And you spike the valve. And now, what you don't do is don't put air into the bottle. I'll show you how it works. You have to kind of remember that don't do what you used to do. So this screws on here. You take your meds out. As I'm pulling down, room air is going in through this filter and replacing the air that was in the vial. So you never get to the point where you have that suction in the vial. Now I can do that, put it aside, come back later, swab the valve again, 15 seconds. Draw more med, maybe I don't want so much this time, do that. And you can just do that repeatedly, and that med in there is still preserved. So I think you'll like that a lot. That's called pin 1, and again, just a couple dollars. Valve itself has a flow rate of 170 milliliters per minute. So you don't have to have any concerns about this slowing down your flow rate. What is the benefit of this? The most important one, I think, other than the safety of not dealing with needles and having to deal with the expense of managing sharps from beginning to end, is the fact that the most modern valves, these 8200 MILA valves, do not create a suction at the tip of, I'll use this catheter, this is better, at the tip of the jugular catheter or an IV catheter. Historically, we all know that when you disconnect a syringe from a catheter, that a small bit of suction just happens at the tip of the catheter, which draws a minute amount of blood into there. And then that's where the fibrin starts building up and can quite quickly start clogging the catheter and decreasing the flow rate, often leading to having to replace the catheter. So this is extremely valuable benefit of the way this technology inside this valve is made, that you don't get the little suction at the end. I'd like to especially mention that as these valves have been around for some years, different companies, different styles, we have different clamping protocols. Some require you to clamp the tube before you attach the syringe or IV tubing. Another brand requires you to clamp the tubing after you've attached the syringe or the IV tubing. And it's a lot to remember whether it's before or after, and especially if you happen to have two brands in-house or technicians and doctors that work at more than one hospital. And so the benefit of this particular valve from MILA is that it does not require clamping. And as I said, the clamps are on there. You can use them if you want to, just as an extra backup, and because you're used to it, but you really can just take those off if you want to. They work very well, and the neutral displacement, that's the part where the blood does not suction up into the end of the catheter. That all works very well without having the clamp. Now I'm going to tell you some other tidbits here. Never, never, never stick a needle in this valve. Don't stick a needle in any of these valves that are operated with the needle-free style. You will ruin the valve, it won't work, it'll leak, and it's an absolute no-no. Next, do not ever cap it with a normal PRN that has this little stem here. Let me point to that really well. See the little stem? That's the thing that opens the valve. It's the male lure. So never do this. And then you could stick a needle in that, but it won't work. It won't go through, and it's really bad to leave it on because it has the valve open all the time and creates an open system as far as contamination. If you believe that you should have your valve covered, you can certainly buy the ones that have the tethered cap like I talked about before. But we also have stemless caps. They come in packs of 10 and they're very easy to use. If you can see in there, I hope you can. There's no stem in here. It's completely empty. So now that's safe to use that to cover the needle-free cap. How much does it weigh? It's very lightweight. This is the lightest one available. It's 1.86 grams, and we know that size and weight matter with the smallest animals. How many times can you access this? It's actually rated for 600 times. You probably won't use it that many times, but you can feel safe that that's how it's been tested. And you should not have to change these any more frequently than every 72 hours. So if you're changing your normal bungs more frequently than that, you'll save time and money by not having to do that every 72 hours. Thank you very much for your attention today. If you'd like to have some assistance in implementing the needle-free protocol, please call us at MILA or go to our website. We can also help you work through the economics of the needle-free versus the needles. And we're just always here to help you and look forward to making your acquaintance. Thank you so much.